what a partnership goal, and this is, informed by the needs that you have and what you want to achieve as an organization.
Chichi. Recording and I'm
Thank you very much. So for me, everything starts with the community and ends with the community. So community. The second thing that I want to say and I want to conclude with is that if you're thinking of coming up with a technology that's going to solve a public health problem, you need to be able to adapt to change and also be able to manage the change process. Yesterday we had an interesting debate, and I think the folks who were proposing one slightly above half, I wanted to flip the coin again and say, even if the results were the other,
well, I would like to say Abdullah is one that is affected. To help more, especially elderly.
that's very good feedback. I'm very sure you have that my PhD thesis was on bank campaigning. Actually, Lula is a bank campaign. I was finding out if TBS would be effective. That's what I think what we are doing teaching. Okay, my example is that the VIDIHSA, financial exercise material for cross-border programming. We did it as straight away by starting having a branch in Kenya.
you so much to
Sure.
our panelists for sharing such thoughtful and practical insights. Today's discussion has reinforced the value of partnerships and community, especially in the digital health space, and I hope we will all be able to take some valuable points away from this discussion. Unfortunately, we won't have time for Q&A, but you can kindly keep the questions that you had, and we'll have a session at the end where we can interact with each of the panelists. I personally am so impressed. This was such a brilliant panel, and I'm sure you all have further issues that you want to discuss with them, so you can approach them at leisure after the session is done. Thank you so much for your time and your attention. I will now hand over to Andrew to take us through.
Any report better, yeah?
Thank you so much, Dr. Hassan. It's about that. The cameraman, you can be quick.
Bend that back. So, thank you very much. I know I'm standing between you and lunch, and that's why I would like to request you to sustain your love for me. I am likable. I will make this a very short, rapid round. If you have worked with me, you know I keep my promises. Okay, so let's take our seats. I would like to invite to the floor Professor John Charles Okiya. Professor John Charles Okiya is the Dean of the Institute of
the themes that keeps coming up in our conversations is how to fund, where to find funding, including this previous panel. You know, the economics of how we do this. Where are you going to find the funding? What are kind of activities are currently being funded in the country? But in general, what strategies? Yesterday, somebody said, and I repeated this morning, that let's not just spend our money buying a goat, buying a pig. Let's find models that work for us, whether we are resource pooling or not. Let's be able to do that so that we have finances to do what we want to do. So, Dr. Okidia, my first question is to you. Okay. How can your area of professorship is in management, but I also know that you've done a lot of costing in this country. Almost every costing exercise that the ministry has, you are there. So you are at the table when these discussions come up. How can startups raise funding in Uganda? What opportunities are available, both from the government but also from the private sector?
Thank you very much, Professor Rose. So, first of all, maybe because of age, you see, the business I have now is I save time. So, my time was over. So, I'm actually hiring more of my time with another meeting. And there are small things I'm not going to be told. More of panelists. We are now proceeding on to the panelists. Otherwise, the panelists will talk forever. The previous panelists, I think they gave them to moderate me. For me, I can talk for 8 hours without talking. So don't allow the panelists to talk about as they want. Thank you very much, Professor Rose, for yes. Before I come into that, there was a question that was given to me about profitability of investment in healthcare, and that probably now comes into issue of resource mobilization. And we say that service provision of healthcare, people want to invest in it. But we're saying, probably how profitable is this? Before I even talk about where can you get the money to invest in healthcare. You know, one thing you should know, that the most thought good in the world is life. The most thought good, everybody wants increasing customer body of care, of fraternity, or clientele is on people who want life. So every time we have something on. So when you're investing in healthcare, healthcare then becomes a derived need. Because people want to live, people want life, so they will seek healthcare. Now, in terms of investment in healthcare, you'll find that potential in the short run, you do not have the profit that you may be looking at. But in the long run, it is sustainable that you will always have clients. But as amazingly, the dividends of healthcare is not profits of money. So as you take into an investment in healthcare, you should be looking at the dividends in terms of the quality life years adjusted. You should be looking at disability adjusted life years reduced. How many of the people who are staying with less disability for a lesser time? How much of improvement in terms of quality of people's life? For how long and how well they stay? And that's satisfactory in healthcare. Remember, healthcare is actually aligned to God's promise from heaven. You ought to know that people's satisfaction should be a dividend. that the community that you serve is what you provide as your profit. Otherwise, if you set yourself in the bracket of making profits, you are going to detain the bodies in hospitals because you want money. You can't detain the bodies in the hospitals, you want money. Do you know why they detain the bodies? Because in health economics, they have what they call a caring externality. You are compelled that family, because they are caring for the dead, to say do anything to sell to get money, because they want a ceremonial rest of the day. So that's how community comes in, and it becomes catastrophic. So the investment in healthcare, you should be able to understand whether you're investing in equipment, whether you're investing in a clinic, whether you're investing in training, that it's one of the callings that you've come to serve. And all about humanity. So you should never attempt to make it as a business that's going to give you money to buy a plane. But I assure you, so I implore that you yeah. And I said to myself that I'll begin from one room, but I'll go the room. As long as you are situational, you are head is your master. We are not going to look for money for spaces like this. If they are doing it here, they're not doing it here. That was point to them. They are secret in another language. But your mindset, your attitude, and your value, support humanity will bring out the past. I know currently we are dealing with the community health insurance program, national insurance program. That will give you confidence. That will be accredited as a facility. But still, there, because you are accredited for myself, you increase on your capital. You must have the income. I know what is important. Here and here. Who they you can put resources together. But my plea for healthcare is that let the resources for healthcare be built on the humanity values. You know the physicality developed in the pharmacologists in the world, where every molecule is being produced every day. 1% difference in efficacy, but 100 times cost of the price. That's the business one that we end.
Thank you so much, Professor. I will come back to you. I like the ideas of our minds being our first capital, and then of course the community as well. But I will come back to you because again, everything costs. It costs something. It costs value. So we still need to talk about money. Let's move on to Mr. Sekaribe. Mr. Sekaribe, since global health is doing a lot of work around health professionals, education, training, workforce development. That's your bread and butter. Tell us a little bit what efforts Sync Global Health is undertaking in ensuring that we have a digitally skilled health professionals workforce in this country and globally, because your work reaches beyond Uganda.
Yes, thank you. For colleagues who are here to see the for the first time, we are operational in 4 African countries, that's Uganda, Malawi, Zambia, them in maternity and childhood, as well as emergency care. So in Uganda, we mainly partner with training institutions, that's universities, as well as a few selected regional hospitals, to build capacity of the human resource that's working in these hospitals, as well as to ensure that we are bringing up quality workers from the training institutions. So Uganda will support a number of programs in these training institutions. Maybe to mention a few. For example, we're supporting the first professional master's in humanist medicine program at Master's University at Makerere, the first course in master's in humanist medicine. Then also we're supporting the first bachelor in midwifery program, as well as the master's of midwifery at the university and Monash University. We're supporting postmortem programs at other universities, for example, Master of Pediatrics at Sydney University, the first mental fellowship program at Makerere University, introducing specialties in neurologists as well as mental nursing. We know in the entire country we have four specialties in neurologists. We're having the first graduate in the next month, 5 neurologists that are being supported by C. So our areas of support are mainly in dimensions of sections. The first one, of course, we offer scholarships for a few of those professionals or those specialties that are rare and find. For example, emergency medicine, neurologists, and nurses of midwifery. So we offer scholarships to some of these test students that are incapacitated. Then also we do provide full-time lecturers to these training institutions. And that we call them C educators, that is a full-time staff, by the fact that we lack the specialty in the country. And 99% of these staff are foreigners that are brought into the country that already have these specialties. And you can see them to manage the specialty in a foreign country instead of 2 years. Most of these programs are our programs that are foreign countries. So that's some of the evidence. We also provide logistical support. For example, providing items in these programs. Most of these programs are high specialty. Why they need to be part of this, for example, provide items.
So, bro, keep on using them. What is it now? That's very down. Unamwona msogeza ubundi bwa mwe
Just like the model facility, so what we show that all those ones where we have our support in, they are able to do model works at the facility itself. Just like the example I given of the emergency unit at Mara University. At Mara University.
So we need to work around that. But can you add that in your closing remarks or anything else that you might prepare to tell us?
try again the airport. The airport.
I agree. Let me take this opportunity to make an argument fast. The first of his current is coming. I'm a health judge for your I know that you have the opportunity of your life to come and do the course. I can register you in that advantage. Have the program. Two, I have heard about health technology all here. We have a possibility of health technology assessment. So I draw the people who are doing the team. Come over and talk about it. Yes, so what we want to do, what I want to say, there's small things that I can ask you about. Yeah. That the investment in get a loan because you want it into a business. One is free everybody. Bank is asking you one is free everybody. It's not worth looking for. I am not talking about a employee. I'm talking about a person who has
This is the original Mugo.
I've invested in free care, I've invested in free. So this passion of care, I want just to implore you that you see the professionals are able to come in teams and in partnership. But I want you to move in your mind, first of all, the second thing that you should know that is a provision like a provision in healthcare that is paid up for. The form that you get, the dividend of all the care
network kwenye ndege
one public health provision.
were talking there, I was thinking, investing. Are we able to do that? That's something for us to talk about, maybe during lunch. Maybe let's focus more, a little more on that investment. Thank you, Professor. Mr. Secretary, can close us out by talking a little bit about the partnership, private-public partnership. I know that State Global Health does a very good job working with the government. So the question was, what is the role of public-private partnership in unlocking investments in healthcare?
Yeah, thank you, bro. About the public-private partnerships and unlocking investments in healthcare, I think as movement partners, we just need to collectively work with government institutions, and be able to implement any policies from government. It's one place where we can see that we can get the best out of what the government. I can give an example. There are now very many good information systems in business solutions that are being bought by different partners and different knowledgeable people. But as a directive for ministry, for them, they tell you just one on one system, what running in hospital. So what is that untapped gap in maybe that private community growth? Of course, we have had a number of discussions here this morning around integration and having the interoperability of these systems speak to each other. I believe as long as these private systems, private movements are able to speak for the main system of ministry, which is the EA1 system or the HS2 system, these systems are going to be maintained in this facility. But as long as they are not speaking together, there is a large program of interoperability. As opportunities of public or private staff or private organizations support the public.
Thank you so much, ladies and gentlemen. Let's continue our conversations on investment. I want to thank Professor Kilia for loaning us time beyond his slot. And I want to also thank Mr. Geoffrey Sekalembe and also State Global Health for supporting this symposium. Thank you very, very much. Mr. Andrew, as our panelists are taking a picture, please tell us what we are doing next. Thank you very much.
Moderator, I'll say it later. What we did, remember that if you are hiring an assets professional, they have classes. Thank you very much.
Thank you so much, Professor Ross, for moderating that session. Thank you so much, our wonderful panelists. So right about now, I think the photographer can have the photo again. Right about now, I think we are all ready for lunch, and we should be going in for lunch. But just to set the expectations clear, we encourage each one to have really quick lunch for about 40 to 45 minutes. convene back here at 2:30 p.m. Really have our night.
ebuli dakika 18 amatokera bayisala nkya dakika 3.
We have so much interesting stuff after lunch. We'll be doing this bad by not appearing after lunch because you are yet to hear from some very wonderful people to close the day and the closing ceremony happens at the end of the evening. So I want to check that we all have coupons. Do we have coupons from Pastor University? We have coupons? Okay, that's great. For those who have coupons. Okay, so for those with coupons, I will request they stand up and they'll be directed to the pool where there is lunch. But once again, I remind you that yesterday when we launched your clinic, which is digital marketplace for all medical services, over lunch by the beach, or to go to www.yourclinic.com. Your clinic is
every break
YOKLINIC. Create an account and we'll be so excited to have you in your account for that time. And anytime you need a service on there, utilizing the various hospitals, various clinics, all everything on that platform, various there is going to be a QR code for accessing the platform, but yourclinic.com, please create an account on there and feel free to network over lunch. Yeah, you're going to have a very powerful closure today. So please do not miss it. So much. It's extremely you won't find elsewhere. So please feel free. The lady in red at the door will guide you where the pool is. But the staff of Africana are also there to guide you where the lunch happens. Have a great lunch and see you again.
Take the stop.